Welcome back. This is Greg with sportsrehabexpert.com. Today we're going to be discussing limb length discrepancy. You got one leg that's longer than the other, one leg that's shorter, maybe a couple inches off, quote unquote. And how much is this really impacting someone's hip, back pain, foot pain, knee pain? Is it something you should be concerned with, and what you're going to do about it? Now, first off, what I want you to know is that there's a normal amount of variability that will happen at your pelvis, at your low back, and at your limbs. Meaning there is a normal amount of variance that you will typically see in someone's limb length. And let me show you exactly what I mean here. So usually when people are testing this out, they'll have you sit up or lay down, and they'll look at your malleoluses here on the ankle bone and see if they line up with one another. Well, again, remember how we have a normal variance that will occur in limb length. I can easily adjust my limbs for one to be shorter and one to be longer. Again, I can walk my hips back and forth to create a couple inches difference in either side of my limbs. And all of that comes from the amount of variability that is actually occurring at your pelvis. So if that is normal, if that is necessary, and if that is needed for something as simple as walking, running, and jogging, is a couple inches difference between limb lengths in either side actually a big part of the problem? Furthermore, when someone is looking at you laying on a table, can they actually tell how long your limb actually is from a femur and tibia standpoint, or your thigh bone and your shin bone? Can they actually tell that this is structural versus what I just showed previously sitting on the floor of me just moving my pelvis back and forth to create a limb length discrepancy? So again, if you're having some clinician who's just looking at your legs on a table and saying that you in fact have a limb length discrepancy, I would argue to that point is there's no way that that clinician can be very specific with that test, because they don't know how long each of your actual bones are. They don't have x-ray vision. A lot of times even people will tell you when they look at an x-ray, well, one hip seems to be rotated more than the other. So in fact, just that in and of its nature, if you're standing on one limb differently than another, that can create a limb length discrepancy as well too. But that limb length discrepancy isn't permanent. It's simply because you have a tendency to be standing on one limb more than another. So the solution isn't providing somebody with a heel lift to try to push them up off that leg or even out their legs. The solution is to get someone moving their pelvis more equally back and forth, side to side. So right here is what I'm talking about. Is you'll see a lot of people when they stand, they'll stand shifted over on one leg, or they'll stand shifted over onto the other leg, or they stand on one leg and just kind of let the other just sort of free float around all the time. So this in and of itself creates changes in the pelvis from a rotational standpoint that is not problematic, but if you have a tendency to do something in a particular fashion over and over again, can result in a tendency, a movement tendency to occur that can be found on an orthopedic examination. But again, that's not necessarily problematic. What's problematic is if you can't alternate and reciprocate back and forth between sides of your body equally. Here's another example of limb length discrepancy that I can create on my own. I can simply just lift one leg up. And again, you can see that I'm keeping my knees straight. So my limb length, my femur, and my shin bone isn't changing any length at all. This amount of variability is coming strictly from my pelvis in the low back. So again, if you can't test limb length from a standpoint of what's coming from the pelvis versus what's coming structurally from the bones themselves, if you can't be able to discern between the two, there's no point in measuring it in the first place, because you don't know how significant of a contribution might be from structurally of the actual limb length themselves, or what could be occurring simply from a normal amount of variability in movement that should naturally happen at the pelvis. Now, in movement terms, we call this variability simply walking, the ability to alternate back and forth. Move your pelvis from side to side and do the same thing as you can do on one side, do the same thing on the opposite side. It's when you can't alternate back and forth that problems generally occur. This is a pelvis, obviously, so it doesn't move as much as your joint structure. This is very flimsy, but in general, when you move back and forth, you can see how the sacrum moves similar to a rudder on a boat to direct you in the direction that you're going to help you alternate back and forth. Now again, if we go back to this test that everybody loves to do is check your limb length in sitting here, we can again see how rotation of the pelvis will influence the length of the femur. As we move back and forth, there's a shortening and a lengthening effect that will happen to the long bones here as a result of the pelvis movement. Furthermore, if we look at someone's foot, the ability to control your foot in your arch will have an impact on leg length as well too. So a collapsed arch or a flattened, excessively flattened foot will result in a dropped pelvis. A high arch, arch that lifts up, which it should be able to accomplish both of these positions normally and naturally, this high arch position is going to result in an upward displacement of the hip and the pelvis. So hopefully you can catch my drift here at this point in time to tell you that there's a lot of normal variance that will happen in someone's limb length discrepancy, quote unquote discrepancy. There is no discrepancy. It's a normal occurrence that is necessary and needed for movements such as walking, running, and jogging. We have a normal amount of variance in our limbs length's ability to lengthen and shorten naturally from multiple different joint levels. So do you think putting a little wedge that raises your heel up in your shoe is going to solve all those problems? Absolutely not. It might give you some type of temporary, momentary relief if you struggle at alternating or shifting your weight back and forth between sides and creating this reciprocal and alternating action. Creating a minor adjustment through some type of manual therapy intervention or some type of heel lift intervention might create a temporary relief in your symptoms. But if you don't resolve your movement coordination and movement tendencies to be able to alternate and reciprocate back and forth between your legs and create this buffer zone side to side between your body, then you're always going to present with this problem. So the ending portion of this video is going to go over a few different exercises that can help get you to alternate back and forth, weight shift back and forth more symmetrically between the sides of your body so that you can be more aware of where your center of mass is in relationship to the line of gravity, as well as help coordinate the ability to shift your body back and forth between sides and to move your pelvis, move your femur, move your shin, move your foot in a way that controls gravity and puts you in control of the solution as opposed to some type of shoe wear, some type of footwear, or some type of clinician who always needs to adjust your hips.
Now, with any online recommendations, again, these are all just general. I have no idea about your current circumstances and your current capabilities and your current capacity. So I have no way of giving you a specific recommendation. So you can try these at your own risk and do them at your own tolerance. But if you'd like more specific guidance, because technique on these exercises are super important, so you do get the biomechanics right, so you do learn to shift from side to side in your pelvis more optimally, then you can reach out to me at greg@sportsrehabexpert.com, and I'd be more than happy to help you out. Doing exercises all willy-nilly without any sort of direction, purpose, or intent will not yield you the results that you are looking for.
So hopefully you found this video useful. If you like a strength and conditioning program that takes into consideration all these factors and helps build a stronger, more flexible, athletic, resilient body, then check out our 0-week links workout at sportsrehabexpert.com. If you're a rehab clinician, you can earn CEUs through our Sports Rehab Expert certification. You learn how we go about addressing various different issues, movement limitations in our patients. And then if you just need more specific one-on-one help, feel free to reach out to me at greg@sportsrehabexpert.com. Let me know about your current situation, your current problems, and I'd be more than happy to direct you in a manner that I think would be useful for your current circumstances. Let us know if you found this video useful in the comments below. Be sure to like and subscribe to the channel, and type any future videos you'd also like to see down in the comments below so we can keep making content that's helpful and relevant to you.